Today we're going to take a look at how you can strengthen these muscles that help to support your pelvis and the stability of your pelvis. These muscles are called your lateral hip muscles. They're the muscles on the outsides of your pelvis, and they're notoriously weak for most of us. So if you were able to play with walking with your feet pelvis width apart that we practiced yesterday, and you found that that was hard or felt really strange or felt a little bit like you were walking like Frankenstein, this exercise that I'm going to show you is going to help target and hone in on developing the strength in these lateral hip muscles. Now, before we move forward, if you are someone who is experiencing SPD or symphysis pubic disorder dysfunction, or you're having pain or discomfort in your pubic bone, you may not want to do this exercise. So I'm just putting that out there. This exercise asks you to support yourself on one leg and then the other leg, and that can sometimes be problematic if you're having pubic bone discomfort. So if you're working with a physical therapist or you have a healthcare provider, check with them first before doing this exercise if you're noticing discomfort in that area. For the rest of you, we're going to be walking sideways essentially. So we're going to start off with our feet facing forward, straight outside edges. We're going to have the width of the ankles matching the width of our pelvis. And we're going to step out about 6 inches, come back to both legs, and then we're going to shift our weight and come back to our original ankle width. And we're going to travel sideways as we do this. So we're just stepping out and bringing the feet back to our original stance width. And as we go through this, I'm going to be adding on some fine tuning. So as you reach the end of one side, we'll shift and travel back the other side. So one of the big things to keep track of as you're doing this is, are your feet turning out as you go along? And if so, change that so that the outside edge maintains a straight edge. And one of the things that may be helpful is this feeling. You might want to think about leading with your heel as you step out. You're not really having the heel go first, but just thinking about leading with the heel can be helpful to keep the outside edge of the foot straight. The next thing we're going to check with as we do this is how much side-to-side movement is happening with your pelvis. Is your torso doing a lot of the work? And if so, can you quiet that? Can you stabilize your torso so that the work is happening primarily right here at the sides of your hips? If you find that your low back feels like it's doing some work, I want you to see, can you fold forward a little bit? Is there some way you can change things to take the workload off of your back and put it onto the sides, these muscles at the sides of your pelvis? So we're just going to take a break a minute. What can happen when these muscles are really weak, our low back muscles, ever the generous helper outers, will jump in and try to generate the movement or support or help out in some other way. So if you're noticing that your low back feels kind of tight, a little achy, you might want to check that you're not thrusting your ribs, but instead, can you relax them down? And you might also need to even hinge forward a little bit as you do the exercise, which is fine. You're not going to move through life in this way, but just for the purpose of really targeting and honing in on these muscles, you're welcome to hinge forward as you do it. All right, so we're going to do one more pass, and we're going to add one more thing into the equation. So you're focused on keeping the outside edges of your feet straight. You're focusing on relaxing the ribs down so your low back isn't doing the work. And then the next piece that you're going to think about is, can you land heel toe with both feet instead of toe heel? And just a reminder, you're also thinking about keeping your torso as stable as possible. So we're juggling a lot, and at any point, if you're feeling like just keeping the outside edges of your feet straight is plenty for you to manage, that's fine. Stop with that. Let that be your one focus as you do this exercise. And then when you're ready to progress, when that becomes more of a habit and easier for you to do, then you can think about stabilizing your torso, or you can think about keeping the ribs relaxed down, or you can think about landing heel toe with every step that you take. So you don't have to juggle all of this. I'm throwing out things for you to continue working on as you play with this exercise. And again, it does not have to be all at once. In fact, that can lead to short-circuiting of the brain, frustration, and throwing in the towel, which we don't want. Throwing in the towel doesn't help anybody. So just do a little bit at a time, and you will reap the benefits. So you should be feeling the work happening right through here. You should feel a little fatigue, a little, oh yeah, that's been working, all right? So then you know that is you effectively targeted the muscle, the lateral hip muscles that we were going after. So see if you can sprinkle this exercise into your day a little bit. I often do this when I'm brushing my teeth, okay? So I'm brushing, especially if you have a toothbrush with a timer on it, you can do 30 seconds one way, 30 seconds the other way, switch it up. If you're on the phone, talking on the phone is another nice time to work this in. The playground with the kids, I'm the weirdo at the playground, walking sideways doing this. When my daughter was younger and walked a lot slower, sometimes to ease my impatience, I would do the monster walk as I was walking with her. So it gave me something to do, and I wasn't frustrated that she was going so slow, and it was also helping to strengthen my lateral hip muscles. So there's lots of times you can take a 1-minute break and work this in, and you're going to be supporting the strength of the lateral hip muscles, which is going to be helping support the stability of your pelvis as you continue to progress through your pregnancy. Enjoy.